Hello, everyone. Thank you for joining us today. I am Irina Polanco-Ventura, Director of Public Health Initiatives at the Partnership for Maternal and Child Health. We are glad that you have chosen to register for the first presentation of our four-part webinar series. Every Thursday this month, in honor of Maternal Mental Health Awareness Week, we will be joined by experts in the field to discuss topics related to mental health in both mothers and fathers. Before we get started, I'd like to thank the New Jersey Department of Health for funding this important series. Now for some housekeeping items. We will be muting all attendees' phones during this webinar, but we would love to hear from you. So please write in your questions in the chat box, and the speaker will respond to as many as possible at the conclusion of the presentation. To receive a certificate of completion, you must listen to the entire webinar and complete the evaluation survey. Certificates of completion will be sent via email within 1 week of the webinar broadcast. This program is being recorded and will be available on the Partnership's YouTube channel. An hour after the webinar ends, you will receive an email with a link to a post-program evaluation. Please complete the survey to provide us with feedback on the program. Today's webinar is entitled Mental Health in Pregnancy and Postpartum During COVID-19. Clinical Tips and Strategies for Helping Your Patients Manage Anxiety. Our speaker is Dr. Pooja Lakshmin. Dr. Lakshmin is a board-certified psychiatrist and writer specializing in women's mental health and perinatal psychiatry. She is a clinical assistant professor of psychiatry at the George Washington University School of Medicine and maintains a private practice in Washington, D.C. She serves on the board of directors for the Maternal Mental Health Leadership Alliance, a national nonprofit dedicated to further maternal mental health policy, and the editorial advisory board of Clinical Psychiatry News. Dr. Lakshmin is active in advocacy work and community building through online platforms. She is working on a book about the tyranny of self-care and is a frequent contributor to the New York Times. She has also been featured in Glamour, Harper's Bazaar, Bustle, and various other media outlets. You can follow her on Instagram at Women's Mental Health Doc. Thank you so much for joining us today, Dr. Lakshmin.
Thank you, Irina, for that great introduction, and thank you to the partnership for having me. I'm really excited to be here with you guys today, and I'm looking forward to sharing some tips and strategies that can help our moms out there right now. So I'll just go ahead and get started. Like Irina said, I'm Dr. Pooja Lakshmin. I'm a perinatal psychiatrist in Washington, D.C., and I'm a clinical assistant professor of psychiatry at the George Washington University School of Medicine. And I'm very happy to be here today to share some strategies that all of you can use in your clinic taking care of patients. So first, I should say that I don't have any conflicts of interest to disclose. And also that all the information that I'm talking about here today is not medical advice, it's for education. So if anybody out there is watching the recording and is in need of help, here are some resources. I also will be sharing resources for patients and for providers at the very end of the presentation as well. So today we'll cover essentially what I'm seeing on the ground as a perinatal psychiatrist who takes care of women who are pregnant or postpartum. And I'll share some of my thought process around the anxieties and the fear and stress that I'm seeing in my patients right now. And then we'll go on to some practical tips that healthcare workers can use right now to help patients in the moment in clinic, and also some skills that you can teach your patients as well to deal with stress and anxiety. And then finally, at the end, I'll talk a little bit about briefly covering signs and symptoms of perinatal mood and anxiety disorders. I know there'll be another presentation in this series later this month going more in depth into that topic. And then we'll end on sharing some resources. So just to get the lay of the land, there's been a little bit of work done already looking at what is mental health like in the pandemic right now. And we know from previous large-scale infectious disease outbreaks that the impact of social distancing and quarantine measures on our patients is definitely significant. Specifically, negative psychological effects associated with the longer duration of social distancing or quarantine, fears about infection, inadequate information and stress around that, and then of course the financial losses and the job loss that we're seeing in huge numbers, and the stigma around potentially having a diagnosis and being infected. There's also been some work looking at children specifically and the effects of quarantine. And so today we're specifically going to be talking about women who are pregnant. And while there's been some work looking at the mental health effects in general, there really isn't any research or literature yet looking at pregnant and postpartum women during this pandemic, but the media has picked up on it a little bit in the past 2 months, and I think people are starting to recognize that women who are pregnant and postpartum right now are in a uniquely vulnerable situation, one that nobody has ever experienced before. So what I'm seeing in my practice is that there is a significant amount of fear and anxiety around a couple different categories in terms of pregnancy and postpartum. One being the fears around what will happen during delivery, uncertainty around whether mom will be able to have her support person with her in the delivery room, whether she'll be somebody who tests positive for COVID and has to be, or if a decision is made that she will be separated from her infant. Moms are very, very worried about that. And then, of course, fear about going through a postpartum period that is much more isolated and alone than she had expected. And not only is there fear and stress about all of these uncertainties, there's also quite a bit of grief as well around grieving the loss of the expected birth experience and the expected postpartum experience. So we'll go on to talk a little bit about how you can talk to your patients about grief and provide a structure for them to be able to process some of the emotions that they might be feeling right now. So going in a little bit further to the specific fears about delivery, one of the biggest things that I'm seeing is fear and anxiety about whether partners will be allowed in the delivery room. And now that there's around the country, there's quite a bit more testing and even universal testing for women that are showing up to hospitals in L&D. Women are really worried that they might be part of that 15% of women who are asymptomatic and might be testing positive for COVID, and then fears around having to potentially be separated from their newborn. There's also anxiety around what the labor process will look like and whether they'll be able to labor comfortably with a mask on, because as I'm sure all of you know, wearing a mask can cause anxiety for some women, especially in the labor process. And then fears around being separated from older children and how to navigate childcare issues with older children as well. So, like I mentioned just a second ago, many women are experiencing grief around this process. So, grief is a common psychological response to unexpected circumstances. And what we're seeing right now is certainly an unexpected circumstance. So our patients have really lost their normal or their expected birth plan, and they're now faced with uncertainty and in some cases a birth that isn't the one that they would have chosen for themselves. I'm sure all of you are familiar with the Kubler-Ross stages of grief. I'm seeing my patients move through these stages as they come to accept this new reality that we're living in. And there's a couple important points that I think can be helpful for you all as practitioners who are working with women in your clinics, that you can provide some education to your patients, some psychoeducation around grief. The first piece is that this is a completely normal response, that this is common, that all women who are pregnant right now or who are postpartum right now are facing some version of this. So just by providing validation and normalizing this psychological and emotional response, that really goes a long way. Second, you should educate your patients around the fact that these different stages, these different emotions that they'll experience are not linear. So they're going to find themselves swinging back and forth between denial and just sort of completely wanting to avoid the fact that their birth is going to look different than they'd expected, and then swinging to sadness and depressed mood and then anger. That it's not a linear process. And with each new loss that comes up in the experience of pregnancy and postpartum, that they're going to feel more of this. So they really should prepare themselves for waves of emotions. And we'll discuss as we go along in today's presentation strategies that you can share with them for how to deal with those waves of big emotions. The other thing is that with each loss that comes up over the course of pregnancy and postpartum, women are going to experience a little bout of grief with each one. So whether that's in the beginning, finding out that their partner can't be there for their first ultrasound, or they're not going to be able to have a baby shower, or finding out that they may not be able to have a support person with them. Each of those experiences is its own loss and will need to be grieved as well. And lastly, as healthcare providers, I think it's really important that we meet our patients where they're at. So if you come across a woman in your clinic who is really at that anger and frustration stage, knowing that it's not going to be helpful for you to try and push her into acceptance, because she's not ready to get there. So the best thing that you can do for somebody who's frustrated and angry is just validate and say, things like, it makes sense that you feel this way. I understand that you're angry right now. Just kind of validating her anger and not trying to take away her feelings, because that's just going to make it worse. So then if we look at the postpartum period in particular, what I'm seeing is a lot of fear around just the logistics of being postpartum and not being able to have all of the friends and family members who you had planned to come and provide support. So, not having those meal trains. Maybe you were planning on having a postpartum doula who can't come anymore. Maybe you have family members that live across the country and can't fly to come be with you. So because of social distancing, we're really seeing a higher level of what's called the mental load. So the mental load refers to all of the invisible tasks that go along with managing a household. And we know that women bear the disproportionate load of this work. So there was a study in 2019 that looked at 400 partnered women and found that women who bear a disproportionate amount of household burdens and child rearing burdens were also found to have lower scores on well-being indexes and lower relationship satisfaction. The same study also found that women who had higher levels of domestic responsibilities were more likely to feel a sense of emptiness, or to look around at their life and sort of say, is this all there is? Kind of feeling this meaninglessness despite raising a family and having a job and doing all the things, having all the things in their life, they still kind of felt like it was empty. So I'm seeing anticipatory anxiety around how to deal with this lack of support when so much of the burden is falling on women right now. Then the other thing that I'm seeing is stress and uncertainty about how to safely take care of a newborn. I run a Facebook group with two of my colleagues, an OBGYN and a pediatrician, and it's called COVID-19 Maternal Wellbeing, and we have almost 5,000 women in the group already. And it's a place for evidence-based information, and it's also a place for moms to share with each other and get support. And there's just a ton of questions around, when is it okay to have family visit? Can I take the baby out of the house? Should the baby wear a mask? Just a lot of questions that there's not clear answers to, and medical providers, we're all doing our best to answer these questions as best we can, but we also have limited information. So it's just a time of a lot of uncertainty, not only for providers, but also for patients. Along with this, there's a good amount of stress and fear about setting boundaries with family members or with loved ones who don't understand why an infant should not be exposed to unnecessary people right now. So moms that are really stressed out about how to set these boundaries with family members and guests. And finally, like we were discussing, grief, that the postpartum period isn't going to be or feeling like it isn't going to be this happy or celebratory, joyous time, because they're just not going to be able to have all of the family over to meet the baby. So grieving that loss as well. So now that we've kind of talked a little bit about the lay of the land and what's going on emotionally for pregnant and postpartum women right now, we're going to spend the rest of the presentation talking more about strategies that you all can use in your clinic when you're faced with a pregnant woman or a postpartum woman who is stressed right now. So there's a couple tangible things that you can do as a provider. Like we talked about, acknowledging and validating the grief goes a long way. So saying things like, I know that this is really difficult to hear. It makes sense that you're upset. Just letting them know that you understand their feelings is one of the most powerful things that you can do as a provider. The other thing is really over communicate what's going on from a policy standpoint in your clinics, because patients are worried about safety in terms of about going in for prenatal visits and then for bringing their babies in for well baby checks. So let your patients know clearly what precautions are being taken. If you work in OB, around the policies for delivery, how to get virtual support during delivery, should patients be bringing their own devices or not. March of Dimes has a great birth plan document that's been updated for COVID-19, which I've linked in the resources slide at the very end. So that's a great resource that you could share with your patients. I would even consider just having lots of signage everywhere about all of these different policies. I think that it's not possible to communicate too much around this stuff because women are just feeling so much anxiety about it. And then in terms of the postpartum period and social distancing, what I'm seeing is that having this be something that's sort of quote unquote doctor's orders or a prescription can really go a long way in alleviating the anxiety for new moms who are really worried about the reactions that they might get from their family. So if you could have a little note that you give to your patients, or a standard handout that your office gives out to everybody, that this is what we recommend, sort of written for family members, so family members can read it and say, okay, this is what we're supposed to do, that really will go a long way as well. So now getting into some of the specific strategies that I wanted to share with you all. We're going to go kind of generally, and then we'll dive into more detail in some of them as well. So of course, and I'm sure you're hearing this everywhere, but limiting media intake is so important right now, so important. My pregnant patients, I'm really telling them to cut out the news as much as possible, and they're finding that they feel so much better when they're not reading the news. And I say that that's okay, that they don't need to feel obligated to be kind of watching, scrolling through, keeping up with every single detail, because it's not really going to change their day-to-day practice. They're all social distancing. They're avoiding going out. When they do go out, they're wearing a mask, right? So those things aren't really changing. So just reminding your patients to to limit how much they're taking in the news. And then if they are taking in information, making sure that it's good sources like CDC or information that's coming out from medical practices and things like that. Sticking to routines, this is huge right now because we don't have, our patients don't have the external structure of going to work every day or, kids going to school. We're having to make our own structure. And so two pieces that are the most important for that. One is making your own transition times because we don't have kind of the commute driving to work or, after drop off with the kids. So you have to just make those little spaces for yourself. And then also having physical boundaries as well. If your patients are lucky enough to live in a house where there's different rooms, using different rooms for different parts of your day, but even if they live in an apartment saying, this is my desk and this is where I do work, and this is the chair where, I eat my lunch, and then this is, the table where I help my kids with their schoolwork, or just kind of creating some separation and distance is very helpful. Of course, physical activity and getting outside is huge right now. And then one strategy that's called name it to tame it. So essentially paying attention to when anxiety comes up and recognizing that it's anxiety. A lot of times our patients don't fully realize that the thoughts that are swirling in their head, sort of all of the what ifs and things like that, that's actually anxiety. They've never fully no one's ever told them and named those thoughts as anxiety. It's important for patients to really stay connected virtually with their support systems right now and their communities. So really encouraging them not to isolate themselves, to do as much virtual interaction as possible. And then focusing on areas of life where they do have control or agency, and we'll go into a little bit more detail about this, but especially for our pregnant and postpartum patients who are kind of looking down the line over the next few months and not really sure what is the situation going to be like with COVID, what are the policies going to be, if they're delivering in July or August or this fall. There's just so much that is outside of their control. So I'm really encouraging my patients to try and stay present in the here and now and just take things day by day. What's one thing that I have control over in my life today? Can I pick one task today that I can do from start to finish, whether that's, picking out a recipe and making it for dinner, or whether that's tidying up a room in the house or an area of your apartment, but basically doing tasks from start to finish is really going to help with bringing back that feeling of confidence or that feeling of mastery that so many of us are lacking right now because of all of the uncertainty. And when you do those little things, it helps you feel, like I said, more of a sense of confidence, and then it's a little bit easier to take on some of those big decisions or to deal with sort of those larger senses of uncertainty. Another specific tip is this strategy of using worry time. So essentially, this is setting aside, so this is helpful for patients who are having ruminating anxiety over the same thing over and over again. So pregnant women who are ruminating about delivery and what it's going to be like, what you do is you have them set aside 20 minutes every day, the same time every day, where they're allowed to worry about whatever they want. No judgment. They can just let their brain go wild with the worries about everything that's out of their control. But then if any anxiety or worry comes up outside of those 20 minutes, they're not allowed to indulge it. So what they have to do is write it down on a piece of paper or a journal or, on the notes app in their phone, and they save it for the next day's worry time. I really like this strategy. I use it myself because it's not like you're telling yourself, hey, just stop being anxious, because we know that that never works. But it's just saying to yourself, okay, I can think about this, but just not right now. The other thing that's nice about it is that plenty of times when you go to the next day and look back at the other worries, they're not as salient anymore. So it reminds you and gives you a perspective that feelings don't last forever, which if you're somebody who's struggling with anxiety, remembering that is huge. Behavioral activation is the theory that when we do things that make us feel good, we feel better, and then that motivates us to continue to do things that make us feel good. And then the opposite is true as well. So really encouraging your patients, daily physical activity, sticking to routines, avoiding isolation, all of those are kind of behavioral activation strategies that we know will make patients feel good. And if they can kind of stick to those things, it'll be easier for them to continue to feel better. And then grounding skills is what I'm going to talk about in more detail in the next slide. So emotional grounding basically means bringing back into focus what's happening in the here and now, instead of being caught up with all the thoughts that are running through your mind. So grounding skills are essentially different strategies for getting us back into our bodies. And that's really the best way to get to the here and now, paying attention to your senses. So these are just a couple different tools that I like to recommend to my patients, and I also use myself. Walking meditation is really simple, and you can even do it inside. Taking your shoes off, rocking across the room back and forth, and just paying attention to your heel hitting the ground, your toes on the floor, slowing down your movements, feeling the muscles in your legs, paying attention to your surroundings. You could do that for 2 minutes, and it really helps to bring you back into your body and helps with cutting off that sort of monkey brain that's just going and going and going. Another strategy is hands under cold water. So this is helpful if you have patients with panic attacks, or who have these waves of intense emotions, let's say in dealing with the grief that's coming up. So when a patient feels something like this coming up, they can put their hands into cold running water, or even an ice bucket, or splash cold water on their face. That sensory stimulation brings them back into their bodies and breaks through with some of that disassociation that's going on. Mindful breathing also is another strategy where you focus on your breath, and you can do breath counting as well on the inhale and the exhale. And when the mind wanders, which it will, you just bring it back to the breath. And that's the point of mindfulness, essentially that point where you're bringing your attention back to the point of focus. And this is grounding because, again, it's having you in your senses and pay attention to your body. And then another strategy, similarly to if you have a patient that copes with extreme anxiety or panic attacks, when they feel something like this building up, having them sit in a chair, ground their feet on the floor, and describe in detail one thing that they hear or see going on in the room, that just has them focus on their senses and what's going on, and distracts them from those anxious thoughts. So these are all different versions of emotional grounding, and there's lots of other strategies out there, but these are just a couple that I like. So a little bit earlier, I talked about identifying coping skills. So essentially, coping skills are just techniques, so are basically practices that we all have, whether consciously or unconsciously, that help us feel better in times of stress. So one method to help a patient in the moment with figuring out their coping skills is ask them to think about a prior time when they went through a hardship or they went through something difficult. So you can also ask reflective questions like, what's helped you get through difficult times in the past? Can you think of a particularly difficult time you got through, and how did you deal with it? So really just cueing them to think about how they've overcome struggles in the past, instead of focusing on what's going on right here and now, helping to build resilience and remind them that they have overcome obstacles before. So these questions are essentially a way to put some structure and some scaffolding around, the giant ball of anxiety that many of our pregnant patients are feeling right now, and all of those overwhelming complex feelings that are going through their mind. These questions are a way to structure structure their thoughts so they can actually come up with a plan for how to feel better. And this is a strategy that that I learned as a resident at GW and is taught by Dr. James Griffith as well. So there's 4 different ways that people tend to deal with stress. Some folks are really good at emotion regulation. So those grounding skills that I mentioned in the last slide would count as emotion regulation. Other techniques for emotion regulation are things like journaling or talking to a friend or talking to a therapist that is non-judgmental and also is not providing advice, but is just accepting and non-judgmental and listening. Another common strategy is called problem solving. And this is what we talked about a little bit earlier in terms of helping our patients find places where they have agency and where they have control and can take specific action. So we'll get into more detail about how to help patients move through that. This moving through problem solving and helping patients think about solutions, specific solutions to their problems, helps them get out of what we call emotional flooding, or the parts of their brain that are activated when they're feeling intense emotion. And problem solving activates the cortex, which is involved in executive functioning. So it's a way of sort of reframing what's going on for them. Activating identity, so there's different types of identity. There's individual identity, there's group identity. So an example of individual identity could be, a woman who's a mom and really identifies with being a mom, and her identity as a mom is a big part of her sense of self, and taking care of other people, providing for her family is something that's really important to her. So thinking about that and feeling that makes her feel more confident. Or maybe it's a group identity, maybe a faith group or a religious group that brings a sense of confidence and strength. And then, of course, many folks will turn to relationships, and there's different types of relationships, but you can help your patient think through which relationships in their lives provide the biggest sense of comfort or the biggest sense of strength, and see how they can bolster those relationships or bring them back into their life if they're not there right now. So talking a little bit more about problem solving, with some of the issues that our pregnant and postpartum patients are feeling right now, there's really not the perfect solution, or the answer isn't something that they necessarily want to hear. For example, around the postpartum period and childcare, it might be that an elderly relative needs to come because that's the only option for many families that have other children and need that extra support. So when we go through problem solving, it's helpful to talk, instead of talking about risk versus benefit, right now I'm talking a lot about risk versus risk framework and how to mitigate risk. So focusing on how we can minimize the risk as opposed to looking at benefits. It's just a different way to frame the conversation. And again, we want to focus on areas where patients have agency and can make specific decisions. So for example, some of my patients right now who are pregnant and due later this summer or due in the fall, and we still don't really know what the situation will be like, then we're brainstorming different ways that they can start planning or they can start researching. So maybe that looks like, looking up Airbnbs and seeing if there's different options for family to come and stay and quarantine for 2 or 3 weeks beforehand. So instead of staying stuck in the uncertainty, taking some action, even if that's just researching options. And then another place that we can really be really helpful is reminding patients not to get stuck in black and white thinking. So black and white thinking is a cognitive distortion, and it basically keeps us from seeing the world as a nuanced place, or it keeps us from seeing these shades of gray. So for example, something I see with my patients is, if I can't have my partner there with me, my birth is ruined. Or if my family can't come to be with me right after the baby comes, my postpartum period is going to be a disaster. So it's just kind of these blanket black and white statements. And especially for patients who are, struggle with perfectionism or, kind of type A type folks, this type of thinking gets in the way of doing problem solving type work, because they just get so stuck in the fact that their plan is ruined, and then they just kind of ruminate there, and it prevents them from taking any action. So reminding patients of and kind of doing some psychoeducation around black and white thinking can be really helpful. So another technique around problem solving that I like to use is teaching my patients the difference between values and goals. This is important because, like I was just saying, with problem solving, the solutions that we're going to come up with are going to be different right now than what they might have looked like prior to the pandemic. So when this is the case, I really like to guide my patients to identify their values instead of being so goals focused. So goals are concrete tasks that we want to achieve in the world. Like, I want to have a support person in delivery with me, or I want to have an unmedicated spontaneous vaginal delivery, something very tangible that can be achieved. Values are essentially what's underneath our goals, sort of like your why. And you can live by your values as you're working towards your goals. And even if you don't meet your goals, you can still live by your values. So when we're looking at kind of a birth plan that's going to be not what the patient wanted, or when we're looking at a postpartum period that's going to be more isolated, something that's helpful is to have your patient identify their values. And examples of values are things like, compassion, connection, safety, trust, and looking at what are the values of my family, what are the things that I want to encourage and model for my family, and how can we come up with solutions that are still tied to our values, even if the outcome doesn't look exactly the same. So to kind of wrap things up, I want to talk a little bit about the signs of perinatal mood and anxiety disorders, and things to keep in mind when you have patients that are struggling with stress and anxiety, because there are some patients who are going to fall into a clinical category and need to be referred to a therapist or a counselor or even a psychiatrist. So I'm sure that you all know these, but I'm just going to review them anyway. And I know that there's another presentation coming up later this month that will go into much more detail around diagnosis and risk factors and treatment and things like that. For postpartum depression or perinatal depression, so as you know, depression onset can occur during pregnancy and in the postpartum period as well. What we see is a feeling of sadness, hopelessness, meaninglessness, and this sense, women that suffer from depression in postpartum or in pregnancy and postpartum really have this sense that nothing is going to get better, that it really is hopeless, and that they are doomed to feel this way forever. Crying spells are really common. Feelings of guilt and worthlessness, to the point of feeling like a bad mom, intrusive feelings and thoughts of guilt or even shame, inability to sleep when the baby's sleeping. And this could be due to being up, ruminating about things that need to get done, or ruminating about the health of the baby, or not being able to sleep because mom is constantly checking to make sure that the baby's still breathing. And like I said, a sense that life will never get better. And then intrusive anxiety. So while some amount of intrusive think intrusive thoughts is perfectly normal during pregnancy. There was one study looking at 100 moms, and they found that every single mom in that study had had intrusive, unwanted thoughts of accidental harm coming to her baby, and 50% of the moms had had intrusive, unwanted thoughts of intentional harm coming to the baby. So that's normal and that's common, but when those thoughts become persistent and when they're sticky, you know, like they just get stuck and mom can't get past them, and she ends up spiraling into guilt and shame and hopelessness, that's when we worry that this is something that is due to either postpartum depression or postpartum anxiety. And then along with that, an inability to be reassured by medical providers or friends or family. And then, of course, when things get very bad, thoughts that that your family would be better off without you, or even suicidal thoughts or thoughts of hurting the baby. In terms of anxiety, like I just mentioned, and you know, these two go together more often than not, but when we look at anxiety, these intensive, inconsolable, intrusive, unwanted obsessions about the baby's health. I also see those types of thoughts come up around breastfeeding, especially if mom is having trouble with breastfeeding, or if baby is not gaining weight, or if baby was, you know, premature. That's really common. Frequent checking on the baby to make sure that baby's still breathing without feeling any sense of reassurance. Panic attacks, and inability to sleep when the baby's sleeping, like we talked about. Trouble with decision making, because there's this sense that no decision that you make is right. So there's this constant overwhelm and really not being able to, even if friends or family members are saying to you, hey, I'd really like to help, you know, how can I help? What can I do? Women with postpartum anxiety, they're so flooded with emotion that, and their brain is so foggy that it's impossible for them to actually answer those questions and say, hey, you know, that would be great. Could you bring over dinner tomorrow night? Because they just get lost in what's the best thing, what's the right thing, and they can't organize themselves to actually have those conversations. And that's where treatment is really helpful as well, helping with that. And then repeated thoughts or images of something violent happening to the baby as well. And in order for this to meet clinical criteria for depression or for an anxiety disorder, it should be impacting mom's functioning. So her ability to take care of herself or her ability to take care of her baby. And it should last for at least 2 weeks for most days of those 2 weeks. So that's when we worry that this is something that needs treatment and it's not, you know, just kind of typical stress or sleep deprivation from having a new baby. Finally, before we get to resources, I wanted to just quickly mention some brief strategies, or the most important things really, to help minimize the risk of all of this stress and anxiety that women are feeling right now, how to minimize that from escalating into postpartum depression or postpartum anxiety. So the research shows that sleep protection helps to mitigate the risk of perinatal mood and anxiety disorders. But the thing with sleep is that it needs to be consecutive. So we recommend at least 4 to 6 hours. So that, of course, is difficult for new moms that are nursing or pumping to keep up their milk supply. But even if mom can't get it every night, even if she can get it 2 or 3 times a week, that's better than nothing. And then the other strategy where we have a lot of research to support for prevention is social support. And this is where I really like to bring up the mental load as well, because we know that for women, they're the ones that are dealing with all of the logistics of taking care of a newborn, and this unequal division of labor is certainly playing a huge role right now, like we talked about a little bit earlier in coronavirus, and in this new reality that we live in, where, you know, if mom is pregnant or postpartum right now, she might have an older child who, you know, she's trying to homeschool, and there's just so many demands on women right now that this mental load is really overwhelming. I like to tell my patients it's sort of like they're the CEO of their household, as well as the HR rep, as well as the janitor, as well as the admin assistant. You know, all they fill all of the roles. And then finally, I had a new article published in the New York Times yesterday. It came out about how moms can avoid being martyrs, because this is something that I see so much in my patients, and in my work on social media as well. And it doesn't always correlate with a clinical issue, but really how moms are conditioned in our culture to be giving so much of themselves, but not take anything for themselves, and how easy it is to lose yourself as a mom because you're so focused on the well-being of your family, but then not recognize that you're actually carrying around all of this frustration and resentment and anger as well. So one of the things that is important with dealing with this is learning how to deal with guilt that comes. You know, when I teach my patients how to set boundaries and how to say no, they always say, but I feel so guilty, which I can definitely identify with. But one thing I like to remind them is just because you feel guilty doesn't mean that you're making the wrong choice. And guilt doesn't need to be your compass. You can feel guilty, but still draw a boundary as well. And so that's something that I go into a little bit more in this article. So I hope that you'll check it out. And I think that this is particularly important right now, given the pandemic and how much more stress is on moms. So I think it's especially important that we really support our moms even more. So that is everything for today. So I'm going to go through these resources, and then we'll also have Irina jump in because I know she has some resources of her own. But the biggest one is Postpartum Support International, and they have just a huge host of different resources for patients. So right now they're running online support groups almost every day of the week, and they're for different categories of parents, like you know, moms that have babies that are in the NICU, perinatal loss, military moms, and I believe they're free or they're very low cost, and that's the link for those support groups. They also have a provider directory that is searchable by location. So patients can go to that website and type in their location and specifically find a provider in their area. They have a warm line as well that's staffed with volunteers, and it's not a crisis line, but it's a line where patients can call to get help and also to get connected with a coordinator in their state, because Postpartum Support International has chapters in every state. And then those state coordinators can help patients find referrals as well. And if you go to their website, they also have a free hotline for providers where you can get a free consultation with a reproductive psychiatrist. So if you have questions about medications, like starting an antidepressant or things like that, you can go to their website and be linked up with a reproductive psychiatrist who can give you a free consultation to help talk through some of those medical issues. And you can call that number if you're any type of healthcare provider. The Bloom Foundation is offering peer-to-peer support groups right now. I believe they're on Tuesdays. And then the Facebook group that I was mentioning is linked here as well. That's open to all women that are pregnant or postpartum or considering getting pregnant or dealing with infertility or perinatal loss. And then the birth plan that I mentioned that the March of Dimes has is linked here as well. And like I said, that has been updated for COVID to include specific questions that moms can ask their you know, hospitals or OB providers, and strategies as well. And then I also have a guide for pregnant and postpartum women for dealing with mental health issues right now that contains some of these tips and strategies as well as other resources. So hopefully we can link that on the website when this gets posted. And so I'm happy to take questions right now. And I also wanted to ask Irina to jump in if she has any additional resources that she wanted to share through the partnership.
Thank you, Dr. Lakshmin. You can go ahead and take questions because I will be sharing the partnership resources at the end when I close out the webinar.
Okay, great. So let me just see here about the questions.
There should be a little question mark icon near your microphone that you can pull the questions up.
Yes, I found it. Thank you. Oh, perfect. Okay. Okay, so here's one. How can we comfort a client who's in her 3rd trimester of pregnancy and finds herself in losing 3 to 4 people in her family in a space of a week? And then in the meantime, dealing with the fears and grief of losing lost loved ones. What would be the strategy for a case manager to help during this time? So that's awful. I mean, that's just a horrific situation to be in. So I think for this client, holding space for her grief and acknowledging that it's okay for her to feel the way that she does right now. I think somebody like this is going to need a lot of extra support. So, I would probably see somebody like this twice a week if I could during this acute time period. I would be on the lookout for signs and symptoms of depression coming up for her. I don't know if she's had a history of depression in the past, but going through a loss like this is really, really traumatic. I also, after she has the baby, I would be worried for postpartum PTSD as well, because this is a trauma, and it's a trauma that's happening in her pregnancy. So I think that she's going to need a lot of extra support. I would work with her around grief. If there's anybody in your organization that is a grief counselor, or if there's a way that you can refer her to a grief counselor, I think that that would be really helpful. And I would consider her to be very high risk for postpartum depression, postpartum anxiety, postpartum PTSD. So have her be somebody who gets more frequent follow-up after she has the baby. Let's see. What was the Facebook group named? It's COVID-19 Maternal Wellbeing, and the link is in the resources too. One of my pregnant clients experienced a miscarriage last year, and I feel that is exacerbating her current anxiety on top of the pandemic. Yes. So women that have experienced miscarriage or recurrent miscarriage or are going through infertility treatments are at higher risk for developing anxiety and depression during pregnancy and in the postpartum period. They're also at higher risk for PTSD as well after they deliver. So for someone like this, the most important thing is to acknowledge the fact that this miscarriage affected her and work through the conflicted feelings that she has about the fact that she's now pregnant and she will be having a baby, but she's still grieving that miscarriage, and that it's okay to be able to hold both of those sets of feelings, to feel that grief, but also to feel happy for this new pregnancy. The other thing is that women that have experienced miscarriage are then very understandably fearful during a successful pregnancy about whether they will miscarry again. And that can often lead to patients like that avoiding thinking about the pregnancy or sort of disconnecting themselves with the pregnancy. So I would be helping her work on very slowly figuring out how to attach to this pregnancy. And that takes time, but working on gently connecting her to the pregnancy so that once the baby comes, that she does have a good sense of attachment. Let's see. Let's see, how justified to deny admission on the basis of COVID for a pregnant woman? What is your opinion to deal with these kinds of incidents as a midwifery nurse? I guess I'm not totally sure what the writer is asking. I can't speak to kind of OB admissions or things like that in terms of COVID criteria. That's not my area of expertise. So I guess I'm not totally sure what this person is asking, but if you want to clarify in another question, that would be great. Let's see. My patient is currently 20 weeks pregnant with her first child, suffering from uncontrolled anxiety. She's lost 2 family members recently and is very nervous about COVID and her pregnancy, struggling with her weight loss, afraid to leave the house, and now today reports she's having significant issues with work. States she's going through HR issues for her manager, making inappropriate comments about her weight, racial slurs, etc. She's now so stressed when she's working that she gets worked up to the point of vomiting. She's not amenable to starting medications. So she certainly sounds like she meets criteria for depression or anxiety during pregnancy. Sounds like more anxiety, and it's to the point where it's affecting her functioning. So she is somebody who would likely be a good candidate to starting medications, and it sounds like that's not something that she's open to right now. With patients like this, I will see them frequently and we will talk through essentially what are the costs of not getting full treatment, really doing some motivational interviewing with her around if we don't treat this right now, what does your suffering look like right now, and what are the costs if we continue to have this go untreated. I would also talk through with her at what point would she have to get to start medication as well, because sometimes that can be a helpful frame for people to see just how bad things are. I don't know if you've talked with her at all about all of the risks of untreated depression and anxiety during pregnancy and postpartum. Certainly that would be a good place to start so that she fully understands that by not getting treatment, her baby, that there's harm that could come from that as well. I would also want to know a little bit more about why she doesn't want to start medications and really kind of dig into, whether it's stigma or is she worried about safety or, what the reason is. And I think that would kind of guide the conversation as well. Let's see. Is the Facebook COVID-19 group open to support people or just pregnant women? That's a good question. So yeah, if you're a support person, we would love to have you in the group. That would be great. Yep. Do I have any resources in French for clients? And I'm so sorry, I don't, unfortunately. How do you suggest to work through black and white thinking for clients who are cognitively set and in black and white thinking? And yeah, so this is something that I think helping them process the emotions underneath the black and white thinking, because for patients like this, they've been doing the black and white thinking their whole lives, right? So it's not something that's going to change overnight, but again, doing kind of motivational interviewing and challenging some of their beliefs gently. So if they're really stuck on, I know that this is going to be a horrible postpartum period, you can even go with them around, yeah, it sounds like this is really going to be untenable. And I find that when I meet patients that are stuck in black and white thinking where they are, then they sort of have to take a little bit of the opposite position, or it forces them to sort of think about, well, I guess I could call this one friend who's kind of helpful. But you do sort of need to let the patient go there themselves and hold space for them to process a lot of that kind of concrete black and white thinking. Let's see if there's anything else. And can we get the slides? Yes, I'm happy to share the slides. Approaching a new teen mom that is going to be delivering alone. Yeah, I mean, that's really tough, and I would really try and activate any support system that she has that can be present virtually. If she's a teen mom, she's definitely at high risk for postpartum depression, anxiety. So I would have her be someone that gets very close follow-up in the postpartum period. I don't know if Postpartum Support International has specific resources for teen moms, but Irina, do you know any resources for teen moms in particular?
There are some resources that we are aware of at the partnership, and I can share our information to all the folks on the webinar so they can contact us so we can provide them with more specific resources related to Northern New Jersey if that's what they're looking for.
Okay, great, thank you. I'm just seeing if there's anything else here. Is the postpartum support group available to prenatal? The Facebook group, yes. We have women in there who are considering conceiving or trying to conceive as well. Yep. Well, thank you so much, everybody, for coming on, and I hope that you found this helpful. And thank you again to the partnership for having me as well.
Thank you so much, Dr. Lakshmin, and thank you everyone who stayed with us to listen to this webinar. This is such an important topic right now, and while the pandemic may exacerbate conditions that may lead to perinatal depression and anxiety, there are still ways to get support and reduce isolation. So please visit the partnership's website. If you look under programs, you'll learn more about our Hope for Mothers virtual support groups and our emotional health phone support program, which provides free follow-up phone calls to perinatal women. And we can also provide you with a wealth of information in relation to other at-risk populations. We can also provide you with information on mental health therapy in Northern New Jersey. So just a final reminder that in about an hour, you will receive an email with a link to a post-program evaluation. Your feedback is important, so please take the time to complete it. Certificates of completion will be sent via the email you provide on the evaluation, so please check to make sure it is correct, and you should receive it within 1 week. Lastly, a calendar of the partnership's upcoming virtual programs can be found on our website at partnershipmch.org under the Professional Education tab. We also offer on-demand recordings of many of our programs, which are listed there as well. And we encourage you to share today's webinar with your social networks. We hope you can join us at our next educational event, which will be next Thursday, May 14, and we will be featuring Dr. David Levine, who will be speaking on perinatal depression in fathers. So again, I hope you have enjoyed our webinar, and thank you and have a great day.